Have you heard of SUNOSI? Do you know what narcolepsy is? Let's start by listening to a patient's personal experience. Peter's narcolepsy had severely impacted his daily life. He constantly felt drowsy and struggled to stay awake. After trying various treatments without much success, he started taking SUNOSI. Within a few weeks, he experienced a significant improvement in his wakefulness. The drug allowed him to focus better, participate in activities he loved, and overall enjoy a better quality of life. SUNOSI was a game changer for Peter, giving him back the ability to live a more fulfilling life. Hello, I am Greenosis. I'm here to introduce narcolepsy and SUNOSI to you. Narcolepsy is a chronic neurological disorder characterized by excessive daytime sleepiness and sudden attacks of sleep. These sleep attacks can occur at any time, even during important activities. Excessive daytime sleepiness is the inability to stay alert during the day, often leading to falling asleep at inappropriate times. AS can significantly disrupt people's life, affecting their work, relationships, and overall well-being. First, the constant battle against sleepiness can make it extremely difficult to focus on tasks, leading to decreased productivity and errors. And students with narcolepsy may find it challenging to stay awake during classes, leading to poor grades and difficulty retaining information. The unpredictability of sleep attacks can restrict career choices, such as pilots, surgeons, or bus drivers, as many jobs require consistent performance and availability. Second, people with narcolepsy may intend to avoid social gatherings or events due to fear of falling asleep unexpectedly. Sleep attacks can disrupt plans and create frustration for friends and family. Over time, this can lead to misunderstandings and isolation. Third, falling asleep while driving is a major concern for individuals with narcolepsy, posing a significant risk to themselves and others. The constant struggle with sleepiness and the limitations it imposes can lead to feelings of depression, anxiety, and low self-esteem. People with narcolepsy may experience frustration and anger due to their inability to control their sleepiness. Fortunately, we have SUNOSI to alleviate and even eliminate these effects. First, let's review some key concepts. If you are unfamiliar with them, please pause the video to find out. SUNOSI is a medication primarily used to treat AS associated with narcolepsy. The effective constituent of SUNOSI is Solriamfetol. It belongs to a class of drugs known as dopamine and Norepinephrine reuptake inhibitors. Solriamfetol works by blocking the reuptake of dopamine and norepinephrine into the presynaptic neuron, increasing the levels of these neurotransmitters in the synapse. By increasing their levels, Solriamfetol helps to promote wakefulness and reduce excessive daytime sleepiness. A clinical trial shows therapy with Solriamfetol 75 mg or 150 mg once daily improved wakefulness and reduced excessive sleepiness over 12 weeks in adults with narcolepsy. At week 12, significantly greater improvement from baseline was seen in both MWT sleep latency and the ESS score with Solriamfetol 150 mg once daily, and in the ESS score but not MWT sleep latency with Solriamfetol 75 mg once daily relative to placebo. Undoubtedly, SUNOSI improves quality of patients' lives. First, SUNOSI can improve wakefulness during the day, allowing individuals to be more alert and productive. Designed for extended release, SUNOSI provides consistent relief from daytime sleepiness throughout the day. Second, SUNOSI is generally well tolerated by most patients, and compared to traditional stimulants, SUNOSI has a lower risk of abuse and dependence. By reducing excessive daytime sleepiness, SUNOSI can improve overall quality of life. Typically, it takes about 1 hour for SUNOSI to start working, and it improves wakefulness for up to 9 hours. Based on your eligibility, you may be able to pay as little as $9 for a 1-month supply of SUNOSI. Next, let's listen to a patient's story with SUNOSI.
If I told you I was so sleepy during the day, what comes to mind? You might think I'm sleepy because of my lifestyle choices. Most people wouldn't think, oh, he's got a sleep condition. Hi, my name is Mark, and I'm 53 years old, and I'm from Kansas. I have excessive daytime sleepiness due to narcolepsy, and I'm here to share my SUNOSI story. I've been struggling with sleepiness my entire life. I could feel the sleep attack approaching, and I had to give into it. It was like I had to go to sleep. So I remember this one time specifically, I worked at a call center, and they had this little relaxation area. I could feel the sleep attack, so I decided to go in there, and an hour and a half later I woke up, and I was late going back to my shift, and the staff wanted to write me up for sleeping on the job. I needed to go ahead and participate in a sleep study, and out of that study came the diagnosis of narcolepsy. My physician prescribed some medications for excessive daytime sleepiness, and although they might have worked immediately, they kind of wore out after a couple months, and we were back at square one. My physician and I discussed multiple medications. He suggested SUNOSI, and we gave it a shot. SUNOSI makes me feel more awake during the day, so I don't miss out. It has made a difference. I went from sleeping on the couch at a moment's notice to actually living life. SUNOSI made it a very simplified process, 1 pill a day. Before SUNOSI, I know that I was missing out on important moments of life. Like if we went on a trip with the family, everybody knew that Mark had to go back to the room and take a nap because it's just the way it was. With SUNOSI, I don't have to worry about that anymore. So in my experience, the one thing that I would suggest for someone that's struggling with excessive daytime sleepiness, have an honest conversation with your physician and find a solution that works best for you, like SUNOSI works for me.
Instead of coping with excessive daytime sleepiness in your life, try using SUNOSI. It can provide sustained relief for up to 9 hours. Ready to transform your life? Call us or visit our website for more information. We offer comprehensive support, including educational resources and saving cards. Use SUNOSI today and experience the difference. Thanks for your listening.